welcome to another episode of Right Here, Right Now. While the COVID crisis shoved the healthcare workers to the front line, members of our community have stepped up big time in showing their support, in volunteering, fundraising, as well as sewing masks. My guest on the show today is a community leader from San Carlos, Bay Area, whose efforts to make masks and provide them to the front lines has been a movement. Sheryl Greenspan is a pediatric registered nurse for the past 32 years. Formerly a perinatal coordinator at Sequoia Hospital in Redwood City, she has been practicing with her pediatrician husband for the past 3 decades. She was all set to retire when the pandemic hit. Let's hear from her. Welcome, Sheryl. Tell us a little bit about yourself and all the great work that you've been doing regarding delivering PPEs and masks and goodie bags to the frontline workers. And how did that movement come about?
My name is Sheryl Greenspan. I'm a pediatric nurse specialist, and I've been in private practice with my husband for over 32 years. And I started off as a hospital-based neonatal intensive care nurse back in New York. This all happened overnight. I think for everybody, this whole situation happened overnight. And we had people wanting to help and not sure how to put their efforts together. And within a day or two, we were one large group in San Carlos, and we were making masks, face shields, ear savers for nurses, and getting them out to those in need. I hooked up with Marie Violet from Sequoia Hospital, who's our health and wellness director, and I've known her for my entire career. We used to work together in the perinatal department, and she basically said, fly with this in our community. And we've been donating to Sequoia things that they can also give out through their foundation and experiment with and see what we've got out there. And their foundation is incredibly active with all sorts of groups in the Bay Area. So that's just a huge help. But individually, we have worked to collect masks made of linens, cottons, linens, I mean bed linens, cottons that people had, quilters who had stock in their closets. And we've already given away 2,200 masks from everywhere, from homeless shelters to restaurants to nurses needing protection going to and from the hospital to minimize their exposure to their families so that their families don't get what comes home with that worker. Assisted living facilities and hospices have had next to nothing, and we've made sure that they're staying as stocked as we can allow them to be. We've donated to One Life, which delivers food and services throughout the Bay Area. I could name so many organizations that we've connected with. It's really been remarkable. I cringe every time I get an email hearing that someone doesn't have something or needs something. We were granted through a wonderful neighbor here. He helped post sales of a woman who owns Cinnabar Upholstery, and she has been selling masks, but in turn granting us masks through donations and through profits. And yesterday we gave out 136 masks to immunocompromised, high risk, and again, frontline workers, and they were all gone within 24 hours.
Wow.
So our mask count is close to 2,500 distribution at this point.
Pretty amazing, pretty amazing.
Very exciting.
It is.
The Goodie Bag Project was easy. My daughters and I and my husband have always been very active in helping the nursing units at the different hospitals. She works at UCSF, Benioff, and she wanted to bring up something to thank the peds ICU and oncology nurses who have been working endlessly and tirelessly, and the physicians. And we stocked up 3 big Trader Joe's bags filled with individually wrapped snacks, and the thank yous we got were overwhelming in a positive way and in a sad way. Some said they were eating their dinners and lunches and breakfast from the bags we were giving. And I thought, this has to be bigger. We posted it, and overnight raised $1,000 and hundreds and hundreds of boxes of individually wrapped snacks from the Girl Scouts, the Boy Scouts, neighbors, organizations, companies, people who just wanted to jump on board. And we've now distributed 260 goodie bags.
Wow. That's
It's
pretty
been
amazing.
amazing.
Kudos to all of you. Now, there's a lot of people who are interested in volunteering,
Mhm.
and they probably don't really know where to start. Any pointers for them? Any advice?
I think if you have a neighborhood as active as ours, jump on next door. I just checked before we spoke, and we have 4 groups that have spread off of my coordination efforts, which again, these are my friends, my neighbors, patients we haven't seen in years that we've reconnected with, friends I haven't seen since our kids were in elementary school that we're planning to spend more time together. So if anything good has come from that, but they're now forming groups. We have one specific person making masks for the military who are working in the hospitals in Elmhurst, New York,
Mhm.
which they're getting 1 mask a day. And she's desperately seeking military colors to make masks for them. Which do I feel those rules should be held to such a high standard? We're in a crisis. No, but if they have to wear certain colors, we'll make certain colors.
Yeah.
We have a group working with Natalie, who's been one of my amazing mask makers. She's been requested to make 5,000 masks
Wow.
for Life Moves. And that's a huge organization. And I referred several over to her, and they're all helping her. We have other groups in the area through the Lions Club. A girlfriend of mine has gathered 10 sewers, and they're starting today. And if my doorbell rings, I apologize. I put a big sign up, but they're coming to pick up the rest of the material. We have another resource in San Mateo, Marianne, who's working with a large group. So it's easy and available. The other thing that's come up is some people don't sew. So we're making knitted ear savers. We're sewing buttons on headbands to relieve the pressure. We've had nurses come with their faces excoriated, their
Yes.
ears bleeding, calling in sick. I got someone telling me because they couldn't wear a mask anymore. And someone said to me, well, how come you can't wear, what's the big deal? Wearing a mask, you should be all the time. I said, we've never been required for a 12-hour shift to stay in PPE. Try just wearing the mask I gave you around your house for an hour without taking a break.
Yes.
And those people have then responded and said, oh my God, I can't believe it. It's mentally disruptive, it's emotionally disruptive, and it's physically exhausting.
Yes, I would imagine in high pressure environment especially. So what are the current rules and regulations around masks? All the counties have asked everybody to kind of wear
Yeah.
masks every time you step out of the house, and I actually don't see that many people still following the rules. But it seems
I,
like yeah. Any comments on that?
I was a little bit disturbed yesterday. I drove from here down to a physician's office to bring some masks and things and counted 68 people on the streets, and I was the only one wearing a mask.
Yeah.
And today, when I drove home from work at Burton Park, there's a large blinker sign, I think they call them, that says you need to wear a mask put out by
Oh,
the police
okay.
department.
Hmm.
I was very impressed to see that
Yeah.
today.
Yeah.
I think if we really want to make a difference and we want to flatten the curve and we don't want this to go on forever, we have to comply. And I understand fresh air is great. I'm still forgetting when I walk my dog to put my mask on. So I attached one to his leash and to remind me, because it's hard to remember. You think you're escaping to get fresh air, but it's important that if you get into a habit, you'll wear it.
Yeah.
And I don't think we can have any lax on that. I received an email right before you called from a nurse of as probably as long as I've been in the NICU and pediatrics and dealing with small infants, saying, in the old days, we'd keep gloves on and wash our hands as gloves, keeping them on when there was a shortage.
Yeah.
There's different tricks of the trade. I have people in assisted living and in home care and in hospice who have no equipment. They're figuring it out. We're making them gowns to launder themselves. There's things we're going to have to do. We're going to have to change. I'm not saying I want to see a new normal, but we still have to make some changes.
Agree. And how is this? You've been in the nursing profession for 30 years or 30 odd years, right? Many years now. And uh, how has this COVID experience been? I would imagine a tough one, but what are your observations around it from everything that you've seen before?
I think from an office perspective, being in an office-based system now and in a private office, I think people were scared to begin with, calling with every cough and sniffle and different things. And we were still developing what the protocols were. We only had a certain number of reasons to think someone had COVID. Then they added other things like acute bacterial conjunctivitis. And we had seen several of those and never connected that that was something they would then several weeks later say may be a sign. Mm-hmm. Things like losing your sense of smell and taste. These were not things that we connected. So the dots connect every day with new information. So I think we've been able to really speak to a lot of people and say, you don't really need the test as much as you need to stay away from others if you have these symptoms. And looking at things from a practical standpoint, I think seeing the shortages scares me tremendously because we won't be prepared again if this heightens in any way once we bring people back together. I think we still have a tremendous shortage. Some people say it isn't true, but it is true. We've had nurses transferred from non-COVID units to a COVID unit, and they were given a paper mask for the day. You asked about regulations before. They don't want things coming from the outside to the inside, so they're wearing their paper masks in the hospital during the day and then going home in ours. Now facilities are seeing the shortages so huge that they're saying, you know what, we have to make a different protocols for different departments. Radiology, oncology at Kaiser and other hospitals are allowing these, our fabric masks into their units because they don't have a choice. It's better than nothing, and it's protective. And it's also teaching us that we can all help each other through this process.
Got it. Now, are they wearing these masks to also elongate the life of N95? Is what I'm hearing.
What we're doing is we've got a group of people who are making N95 covers, and those do prolong the N95 masks where they're allowed to be worn. ERs are allowing them. Some of the acute floors are not allowing them, and it is hospital to hospital, unit to unit. I think we're just going to have to be learning more and more. If they're causing any harm, they're going to pull them back. But right now, we're not seeing that, and people are taking good care of their masks. And if it will prolong an N95 mask, we need to do it. We have people in COVID units that don't have an N95 mask. They've got a paper surgical mask, which I'm not sure how much that's going to help.
Yeah. Any recommendations or suggestions on making a good mask, or any rejections that you've seen in the past, do's and don'ts?
I think what is most important is that if you make the elastic long enough to shorten, it's better to shorten than need to make it longer, if that makes sense. I always tell people when you get the mask with the elastic loops, you can either tuck to fit correctly or tie a little knot, but if it doesn't cover your nose and chin, it's not working. So don't use that mask. It's got to cover your nose to your chin. We see people wanting to use filters. Great, they leave a slit for filters, but again, you have to be careful. You can't use HEPA filters from vacuum cleaner bags that may include fiberglass pieces because you don't want to be inhaling that. A lot of people are using coffee filters, blue shot cloths, paper towels as their filter. That's fabulous. That's great. The other thing is you can wear your mask, wash it, and wear it again. So filters, I think, have a really good place as long as you're using them correctly. I don't think we're seeing any masks that don't work unless they're giving us them made of too heavy a material that we can't breathe through. You have to remember we have to be able to breathe through the mask. So 100% cotton is ideal, 2 layers, or a layer of almost the baby blanket flannel or flannel sheets with a layer of cotton is fabulous. We're just trying to stay away from heavy duty fabrics. Just hold it up. If you can't breathe through it, it's not going to work. I think we're seeing a lot more 75% cotton, 25% poly, just because we can't get other materials. And I don't have an objection to them. Some people are purists in this, but I think if you're working and you're handing out food to the homeless, or you're doing things where you're not doing physical contact, there's certain ways to be more lenient with your masks.
Okay. And what does the post-COVID world look like to you? Do you think that the healthcare is going to go through any changes that you're anticipating?
My husband and I spoke about this last night walking. I think that we're going to see everything change. I think we're going to look at prevention, and we're going to look at how we're doing things and the best way that we can prevent this from occurring to this height again. I mean, if this is going to be an influenza type thing, we've got to be prepared. You know, in the hospital, we call, well, earthquake preparedness, hospital preparedness, health preparedness. I think preparedness is going to be a big word we're going to see moving forward.
Got it.
Maybe personal preparedness.
Yeah, that too. At all fronts. Now, children are reportedly less susceptible to COVID, is what we're reading. And any comments on that? Because you're a pediatric nurse, what have you been seeing?
Yeah, I think we're looking at them as almost carriers per se. They may not get sick, but their parents do, and their aunts and uncles and their grandparents do. These kids aren't exhibiting the symptoms that we're seeing in adults. I mean, I know that there's a 2-week-old at UCSF with COVID, recent admission. I'm unsure of any specifics about it. It's just been information that's been shared with me, and then we have everyone who's 90 and 91 in nursing homes. But that middle age range of children up to age 12, 13, 14, we're not seeing them be really truly symptomatic. They may have had a cold, but their parents who may get sick from them are truly getting sick. So we have to be very careful of that and mindful of that, children want to be together. They want to hug you. They want to be with their grandparents. My neighbor is very, her children are clear. We're not bringing over the grandchildren. And I'm not sure that isn't a smart idea. I think it's a pretty good idea right now because we're not seeing kids symptomatic.
Right. So that actually brings me to another question that just popped up in my head. Now there's going to be a soft opening in May, supposedly, right? We don't know for sure, but that's what's being said. And a lot of children, the little ones, might be going back to daycare. Now I think 1 through high school, that's shut for the summer too. So what about the little kids who are going to go to daycares and preschools? They tend to put their hands on their mouth and everywhere else. And any tips for our children, including mine? I have a 3-year-old.
Well,
so I would love to know.
What I would love is that they would come up with an antibody test and we would test all these kids and we would know that they've already had it. But I don't know how that's going to work out in our future. I think it's going to be very difficult. When we went through H1N1 and different other types of these things on a smaller scale, we made sure everything was being cleaned. And I think there's going to be much more attention to not using small toys in public daycares and things that are all wipeable and plasticized and things that can be absolutely cleaned. And these are the things we should be thinking about hardcore right now, is how we're going to prevent that spread once we have a soft release.
Right. Now, I believe you're going to be moving soon, right? You've been a real big champion. And what are your future plans? Tell us more.
Well, thank you. I'm going to stay connected to us here through Next Door as long as they don't kick me off. This is my home. My children were born here. We've practiced here our entire career. I want to be a resource to Marie Violet at Sequoia Hospital. We talked this morning, and to all my other mask makers. This isn't me. I've been a gatekeeper my whole life, whether it's in our medical practice, getting people to where they need to be and to the right specialist, or dealing with their insurance, or answering their breastfeeding questions. I'm going to continue my role as long as I'm allowed to, and see what Arizona has to offer for people there wanting to do things. I think it's very neighborhood specific. I know even in our local community, there's some more active than other. We've reached out everywhere from Woodside to Daly City Fire to the COVID-19 hospital in Burlingame. And I cannot tell you if I've had 200 to 300 responses to date saying, we're staying involved and will you help? And I would love to help. I'd be honored to stay in touch. I've shared my email and cell phone all over Next Door. I think we've got a lot more work to do, and you don't have to be in this neighborhood to do it. You can help any neighborhood. I think if everybody reached out to Sequoia Foundation, to Marie Violet, to myself, to Natalie, to Paige Singh, who has been the headband queen for us. She makes kits for people to sew buttons on. So if you can knit, you can crochet, you can sew, you can hand sew, you can make individually wrapped cookies. We have a wonderful pastry baker that's been funded by one of our neighbors. I think we're up to 24 packages of 12 or 2 dozen cookies per 24 boxes. She's just sent us so much, and they're going to the units, and everyone's so grateful.
Wow.
So I just want to still be instrumental as a gatekeeper if I can be, and then send back what I will attempt to make as masks on my sewing machine once I get set up there.
Lovely. How do you exactly organize this drive? Now, is the drop off at your place? How does it work?
So right now I've been accepting donations, and I had a pickup station here for the last couple of months. My pickup station was moved to a woman named Mary Ann in San Mateo, and that's posted on our site. They're working on a huge project. And then Lions Club and Natalie and others are working on this Life Moves drive. They've picked up the rest of my supplies. I've got signage out front of my door saying that my last day to accept is the 29th, but you can donate anything from gloves to disinfectants, to masks, to gowns, to snacks, right over to Sequoia Hospital Valet. You don't have to touch anyone or do anything. Drop a bag out of your car. They put it in the bin. It gets down to the foundation, and the foundation disperses it. So we are trying to make this as easy as possible.
Yeah, this is wonderful work. And lastly, do you have any masks to show us? Or I know last time we spoke, you were showing us something that goes over the ponytail. Those were really cool little.
I would love to. Give me 1 second.
Sure.
Let me share with you some of the amazing things that people are doing. I can bring a face shield out as well. We've had several people volunteering and making face shields from their home on their 3D printers.
Wow.
And for someone who is not in that field at all, I thought, what is this going to be like? They have brought them to our home, and I will share them with you in a moment if you have time.
Yes.
They have been a lifesaver for us.
Mm-hmm.
There's a young man especially that I can speak about who lives in San Carlos who got in touch with me last week wanting my resources. He makes 40 face shields a day and gives them away free of charge.
Wow.
He has raised close to $9,000 on a GoFundMe page for his materials. And he has given face shields to everybody that I've recommended to him, from hospices to hospitals to doctors' offices. I commend him. He's a miracle worker.
Wow.
We've had people making these fabulous ear savers that go on the back of the head so that the nurses can put, or doctors or respiratory therapists can put their masks on and then hook the loops to this, and you feel nothing on the back of your head. It's almost like magic. I put it on and I don't feel anything. And I'm a migraine sufferer, so I would never be able to wear the masks all day like these people do. So we've got these in all shapes and colors, and they've been wonderful. Paige Singh, my amazing friend and mask maker, her children have come to my husband since they were born, and we reconnected on this. She's the bandana lady. She makes beautiful masks, even with a simple little pipe cleaner glued in with elastic and just pleated. We've posted our patterns repeatedly on Nextdoor. If someone doesn't find them, I text them to them or email them to them. And these masks are wonderful because it is covering exactly what needs to be covered. Your chin and your nose. And the pinch, what's nice about it, not only does it help not bother your eyes, when you wear glasses, you can still use them. You mentioned Bailey Finabar, who's made these masks with beautiful instructions. And these really are great for high-risk people because they do cover everything.
Yeah.
And there's 3 layers, and they work wonderful. And this is what went out in our drive. We've had people even go crazy, and that's my last one. But I'm not an Oakland A's fan, but they've done them with the sporting things. And I can see these being auction items in the future.
Exactly.
When, we used to go to silent auctions and we didn't think about masks, right?
True.
People go crazy and colorful, and they really do different shape masks.
That's pretty cool.
It's pretty cool. Yeah. Then we've had our knitters and crocheters jump on board and then knit these ear savers, which I've sent you photos of how you wear them. Yeah. You can wear them here with your mask or above your pony. Just had a big request from Stanford again, and they're so excited to get more tonight. And we just got this whole big bag delivered.
Gosh.
So we're really doing quite well. And another shout out to Paige Singh. She's actually making masks with Hawaiian sort of flare. I don't have the whole bag in front of me. And she's going to be doing them as our second round to Trader Joe's to keep people safe.
Wow. It's pretty amazing.
It's amazing.
It's amazing. I can sew, and this has been on my agenda as well. So I ask on behalf of a lot of people, and there's a lot of people interested. They've already donated, and there's more that since interested.
So we have reached out. Our goodie bags have gone to both UCSF campuses as far as St. Rose on the East Bay down to Stanford, Woodside Fire. So we've gotten all over. I think if there's a need and you have the supplies, just make that need work. I mean, we're not holding. I'm down to 0 masks really that are not reserved. I just received this as a gift from a child life worker at a case manager, at UCSF, and she made looped ties with a T-shirt that you can bring it down and let it drop like a true surgical mask, and then lift it up when you're ready to put it on.
How cool is that?
Yeah, so people are coming up with designs that meet the practicality of their job or of their life in what they're doing. So it's really been very special. The face shields have been, honestly, I had to have someone send me a video because I couldn't believe it. All of our buttons for these headbands are made on 3D printers by our neighbors because you can't find a button if you try. So they wear these and they're wonderful. Also, the same idea is that it's on their head, guys and girls. I have lots of pictures, and they can hook their mask right to the ear saver.
Gosh, check that out. That's pretty awesome. Yes.
Nothing, no pressure on the ear, which is great. So we're trying to make all this available to as many nurses and staff that need it.
Thank you. Much appreciated. Much appreciated. Thank you for your time and all the great work you have been doing.
And you stay safe. And this is the good work. I'm just representing what everybody's doing. You wouldn't, if I could tell you the number of hands that have been in this project, I'm in awe every night when I go to bed. I try to answer every email, text, and everything before I go to sleep. And when I wake up to the most beautiful words from people, whether it was, I'm an asthmatic and haven't left my house, and your mask from our neighbors have let me leave the house. And there's just things that you read and you never thought, at least in my career, it would be something we would be dealing with. And the kindness of others. And I don't think we needed this to show our kindness, but if it's allowed us to do it, then it's a privilege to be part of it.
Totally agree. And you are truly a role model to so many, including mine. Ever since I've heard about you and I read about you, it's been such a pleasure. I was really looking forward to talking to you today. So thank you.